Welcome back to Smitty's Learning Room. Today we continue to have a look at the HSC option Sports Medicine, and we're going to explore the concept of rehabilitation procedures. So having a look at the syllabus, this comes under a new focus question: how is injury rehabilitation managed? And when we look at the students learn about side of the syllabus, we're looking at this rehabilitation processes. So progressive mobilisation, graduated exercise in stretching, conditioning and total body fitness, training, and the use of heat and cold. So let's start by having a look at why do we actually need to use a rehabilitation process. Now, when an athlete has an injury, we need to actually work through that injury and try to ensure that the athlete is ready to return to play without being injured. And so having a look at the syllabus so far, we've looked at types of injuries. We previously had a look at the inflammation process, and we know that in the remodelling stage of the inflammation process, if an athlete returns to the activity too early or doesn't do their rehabilitation effectively, this actually builds up scar tissue, and scar tissue is not as good a quality or not as flexible and strong as what a regular body tissue is. And so therefore, this rehabilitation process is really important to make sure that you work through each stage of the procedure, and also to ensure that you have done several tests to ensure that you're ready to return to play. So, as it says here, returning to play requires a rehabilitation procedure. And so if we employ rehabilitation procedures, we have a decrease in scar tissue and obviously a decrease in pain for the athlete. And an effective rehabilitation process will also increase the strength of the joint or muscle that's been injured, and increase athlete conditioning and physical fitness, and also increase the normal tissue growth and help scar tissue to be processed and exited from the body. So if we have a look at rehabilitation procedures, obviously the first part of it starts with RISA, and that's the immediate rehabilitation that needs to be applied for any injury, whether it's a soft or hard tissue injury. We then look at applying stretching, strengthening, conditioning, training, and have a look at this concept of when are we ready to return to play. So for the rehabilitation procedure, we start by having a look at progressive mobilisation. Now, progressive mobilisation would start after RISA. So remember, with RISA, it's rest, ice, compression, elevation, and referral. And usually the progressive mobilisation stage will start with the referral. So a sports doctor or a physio will start looking at some progressive mobilisation techniques. And so when we have a look at this graph here, we know that over time we will slowly increase the movement. Obviously, what we don't want to see is lots of movement in a short amount of time, or no movement in a long amount of time. So just that steady increase, so progressive or gradual mobilisation. And the reason for this is that it decreases scar tissue development and increases mobility. And so therefore, if we're slowly moving our body, we're slowly getting it back to fitness and back to its state before injury. An example of this would be some light stretching. So for example, if you've rolled an ankle, it could be a simple concept of flexion and extension of the ankle joint to try and stretch the ligaments and muscles around the ankle joint. The next part of the procedures is graduated exercise, and there's three parts to this. And so we have the first part is stretching, then sort of strengthening, and then conditioning, so actually looking at the whole body fitness. And so if we start with the stretching, we know that stretching increases flexibility, and it's also going to increase the muscle fibre movement, so therefore decrease the stiffness within that joint or around the muscles, and decrease the scar tissue. Now, when we're looking at rehabilitation, P&F stretching is the best for rehab, as it increases muscle movement around the injury while stretching. Now, for stage 2, we look at strengthening, and this is all about trying to strengthen the ligaments and the muscles around where the injury has occurred. And what you want to try and do is increase isometric movements, as this increases the muscle length. And if we're increasing muscle length again, that means we're increasing flexibility and movement around the joint or the injury. over time, you can increase the weights to return to the pre-injury strength. So if you have, done a knee injury, to start with, it might just be a simple case of trying to do some squats to strengthen the muscles around the joint. And over time, a coach or a sports practitioner might actually add some weight to that squat to try and strengthen those muscles back to what they were prior to the injury. Now, ensuring this strengthening phase here decreases the chance of a reoccurring injury. If an athlete was just to do the stretching and RISA and sort of go, oh yeah, no, it feels okay, it's ready to go again, and then was to go out and play a game of basketball, be quite a high possibility that that athlete would do the same injury again because the body or the joint is not supported because the muscles aren't strong enough. The third stage is conditioning, so having a look at that concept of the whole body's physical fitness, and this would begin with low intensity skills or drills, so maybe just walking or swimming, like low impact, and then building up to specific skills for sport. So for example, running or kicking. If it's swimming, it might be, and they might start with walking or slow walking in the pool, and then might eventually start to turn into full swimming. The purpose of this stage is to test the readiness to return to play. And so what actually happens is that the body starts to regain its physical fitness and starts to practice some of the skills that they might need. And so therefore, it's able to test whether it's ready to return to play. Once an athlete has gone through that conditioning stage and they've sort of built up their whole body physical fitness, that's when they can start having a look at returning to training. Now, returning to training too early can also increase the chance of reoccurring injury because the athlete is not ready to return to full momentum or full mobility around that joint. Now, when they return to training, they should modify their training to start because this allows for the gradual mobilisation and return of fitness. And so therefore, sometimes when you see top level players, so for example, AFL player who's used to playing in first grade may, drop down to reserve grade when they return from injury because they're not ready for the full intensity of first grade just yet. Now, depending on the type of injury, cardio is generally used to maintain or to regain the fitness at training. So when they return to training, they may just be focusing on cardio training as opposed to weights training and skills drills training. So for example, someone who has a broken clavicle or a broken shoulder and it's a swimmer may not return to swimming straight away because they don't have full function of their arm, but to retain their physical fitness, that they might do is use an indoor bike to train to keep their body moving and work on their cardiovascular fitness. Now, when an athlete can complete full training sessions from the warm-up to skills drills and modified gameplay and a cool down, that means that the rehab procedure has been successful. Finally, we'll look at the concepts of heat and cold treatment throughout the rehabilitation procedures. And now you need to remember for this the acronyms of RISA and HARM. So RISA being the treatment of soft tissue and initial treatment for a hard tissue injury with the use of ice. And when we look at soft tissue injuries and the inflammation response, we look at this concept of harm, which means avoiding heat, alcohol, running and massage during that inflammation stage. And so what you need to understand is that at some stage of the rehabilitation process, ice is really important, and at other stages, heat plays a very important role as well. And so when we look at the use of ice for rehabilitation, it's basically instantly on all injuries where inflammation has occurred. And so that's a soft tissue injury, even a break to the bone. And the reason for this is because it restricts the blood flow and therefore decreasing inflammation, pain and soreness to the area. Now, when we look at heat and the use of heat for rehabilitation, this is usually during the remodelling, strength and conditioning stage. I repeat, you don't want to use heat when the body part is inflamed because it's going to increase blood flow to the area and thus make that inflammation stage happen a lot longer and obviously delay the remodelling stage. And the advantage of using heat is that it increases the blood flow to the area, and so therefore once the body has remodel the tissue, it's really important to increase that blood flow, because what it does is it actually increases the elasticity of the muscles and ligaments, and therefore allows us to have a greater range of movement of the joint or the area where the injury has occurred. So just in summary, having a look at this rehabilitation process, we start with obviously RISA, but then move into progressive mobilisation, so slowly moving the joint over a period of time, rather than doing it quite quickly. Doing it quickly will increase the chance of more injury and obviously delay the rehabilitation process. Then we look at the concept of graduated exercise, and so that's 3 processes. So we start by stretching the body, then strengthening the muscles and ligaments around it, and then conditioning the body back to full physical fitness. We also had a look at the concept of training and the role training plays in rehabilitation, and also the role of heat and cold treatment during the rehabilitation stages.